All right, party people, we are back at it with some parasitology. Let's get it. So we've got a 30-something female with flatulence as well as loose, foul-smelling stools. When they say flatulence, this just is the medical term for passing gas. And when it says loose, foul-smelling stools, anytime you see that type of description, what they're talking about is steatorrhea. Now, steatorrhea is fat in the stool. You might also see references to floating stools or greasy stools, but foul smelling is a clue pointing towards steatorrhea. Now, in this case, you might be wondering, because it's loose and foul smelling, are they referring to more diarrhea or is it more about steatorrhea? When they give you both indications for diarrhea as well as steatorrhea, steatorrhea wins over diarrhea. Now, in this question, they're asking you for the treatment for this patient. So, from the image, what we're looking at is Giardia. This is a unicellular eukaryotic protozoa that causes malabsorptive diarrhea. This explains the steatorrhea. Now, the transmission is waterborne, not just fecal-oral. If they do ask you about this, the correct answer is waterborne. So you want to be thinking about lakes, streams, and wilderness, even if the patient hasn't left the United States. As far as the pathophysiology, Giardia adheres to the small bowel and interferes with absorption. Hence, the malabsorptive diarrhea and steatorrhea. Now, in terms of treatment, we're talking about metronidazole. Now, the mechanism of action for metronidazole is that it causes the formation of toxic metabolites that damage DNA. As far as what metronidazole treats, you want to be thinking about Giardia, Entamoeba histolytica, Trichomonas vaginalis, Gardnerella vaginalis, as well as anaerobes below the diaphragm, and historically, pseudomembranous colitis. However, this is now treated with vancomycin as first line. Also, metronidazole is second line for H. pylori. We could go deeper into each of these organisms, but let's stay focused here. Now, let's address the other ones. As far as Babesia microti, this is wrong. Babesia is treated with atovaquone and azithromycin, or clindamycin as well as quinine in severe cases, but this is not necessarily used on USMLE. The high yield point for this is Babesia causes hemolytic anemia, similar to malaria, but without travel history. Ring forms may be seen on a smear, and what they're going to talk about are Maltese crosses in this example, as you can see on the screen. This is what they mean by a Maltese cross. As far as the vector for Babesia, we're thinking Ixodes ticks. These are the same ticks as Lyme disease and Ehrlichia chafensis, the same tick as Lyme disease. Now, as far as Ehrlichia chafensis, another tick-borne illness spread by Ixodes tick, not in Africa. Now, the presentation is similar to Lyme disease, possibly with a rash. The high-yield detail is that you have phagocytes containing morulae. The morulae that I'm referring to, as you can see in this histoslide, are those little berry-like inclusions. Peep the arrows. Now, you treat this Ehrlichia chafensis with doxycycline. As far as Gardnerella vaginalis, this is the correct answer, because it's another one that metronidazole targets. This causes bacterial vaginosis. Features of bacterial vaginosis is a fishy odor, a positive whiff test with the KOH prep, as well as clue cells. Now, what is a clue cell, you might be asking? These are vaginal epithelial cells covered in bacteria. Again, you treat with metronidazole. As far as Paragonimus westermanni, this is a trematode, a fluke, a parasitic helminth. These are acquired from raw, undercooked crab meat. You treat this with praziquantel. As far as Rickettsia rickettsii, this causes Rocky Mountain spotted fever. Despite the name, it's most commonly found in the east coast of the US. The rash begins on the wrists or ankles and the palms and soles and spreads centripetally. This is a fancy way of saying towards the trunk. Now, the vector for this Rickettsia rickettsii is the Dermacentor wood tick, not an Ixodes tick. Remember that, Dermacentor wood tick for Rickettsia rickettsii. You treat this with doxycycline. Let's spin the block on the major takeaways. The first image I showed you was a Giardia cyst, a unicellular eukaryotic protozoa. Giardia causes malabsorptive diarrhea with steatorrhea. It is waterborne, often associated with lakes or wilderness exposure, and you treat it with metronidazole. Now, metronidazole acts by forming toxic metabolites that damage DNA. All right, that's it for this one. Go crush it.